It's their fear, their ego. They don't want to deal with it. So then they pull out research, right? Oh, there's no research. You can't randomize control trial a 3-year-old. I just want to call out the BS for what it is.
Well, hello, and welcome to another episode of Mind Your Mouth. I am Melissa Mugno. I am your host, and I am pretty excited today. We have a pretty special guest coming on. I'm not going to do too much to introduce him because he doesn't need much introduction. So today we get to bring into the studio Dr. Soroush Zaghi, who is a GOAT and pretty famous to most, but I feel pretty lucky to say he is a friend and we've known each other a pretty long time. He's seen me go through many different phases. And today we get to just talk all things Airway. So without further ado, welcome, Dr. Zaghi. How are you doing today?
Thanks so much, Melissa. It's great to be here with you. I'm actually doing this recording from our new suite here.
I was just going to say the background looks very different right? And really nice.
Yes. And so I thought, the topic that we're going to talk about, that we chatted about was, where we've been and where we're going, and, what better time for us personally in this time of growth and change to kind of talk about all this.
Yeah, well, I was just actually, when your medical assistant came on, I was like, okay, that's a new background either. And it looks super stylish and super slick.
Right. Okay.
And that is very exciting. So thank you so much for giving a little bit of a tidbit exclusive there.
Let me give you a little bit of a little tour.
Yes, of course. Please do.
Remember this? Remember you used to lecture with us back in the day?
So that's me, Zaghi. That's me in the gray sweater.
This is you, huh?
That's me.
Amazing, huh?
Yeah, that's me in the gray sweater.
I wanted to share it. I wanted to share this picture. 8 years ago.
8 years ago. And look, the guy on the left, on the left is Don Tiburcio. That's the doctor where me and Nora showed up to do that one release together. And the person on the right is Tara Urson from Smart Mouth.
Wow. Amazing. Yeah. You might even have better pics for when this goes live that you can use to share with everyone. But my friend Victor, who ended up doing my veneers after my palate expander, right, was in that course there too. So just think, go ahead.
No. It's so fun. I'm like blown away right now that you're putting this picture, because I saw Dr. Victor put it on Instagram and I literally replied to him. I go, that is me. And it really shows how far I've come even in my physical journey.
It's so crazy.
That's so special.
So crazy. All of us. But you know what's the best is that when we first started out, it was just a handful of people. We had seminars for like 10 people, 12 people, like people would come out. You came out, I think you were in Las Vegas at the time. Is that right?
Yeah. So that was actually, that was where I was going to chat a little bit, right? So what had happened there was, I know we've shared it amongst ourselves, but I was in Vegas working. Tara and I had just met. What mainly was happening is I was seeing patients and, we had nobody to do tongue ties. And if you remember, I would send them to you and I would get on the video calls with you. And then eventually both doctors that I was working with, I was like, you guys got to come down and meet this guy. And we all drove down, and that first course was that. And then afterwards we went to Napa, 2 months later.
That's right. And, you did one of our first ones. You would come, you would prepare them, suction hold. We were there. And just to kind of think about how we used to do it then versus how things are so streamlined now, how easy it is to tell patients about the risk and the benefits and the research behind it. And now how we have retrospective studies, prospective studies, randomized studies. So we can walk in very confident, like this is the new standard of care. Whereas before, we were like making it up and exploring and researching and learning through each other's eyes.
It's interesting, when I was telling people that 2015, 16, we were doing Myo, we were playing around with it, but we didn't know what to do with the restrictions. And from a myofunctional therapy standpoint, we could do all the expansion, you could get them so far, but then they would relapse or they would still have a lot of compensations. And, those first couple times being able to talk to you and present to you, it was quite an exciting time. I feel like when we look back to those first couple years, they were very exciting. I mean, it was
Yeah.
like we were such in the forefront of something and really building and spearheading something that
Absolutely.
where we're at
Let me show
today.
you what the suite looks like now. I think you and
Yes,
your
please.
colleagues will, have a little nostalgia for anyone who's like trained with us or studied with us here. So here's where the suite is now. If you go, we've relocated, and it's everything's gone. That big beautiful breed sign is gone.
Oh,
Um,
wow.
yeah, it's kind of
It's
crazy to
like a
see it
little
empty.
bit of
Huh?
an end
Look
of
at
an
that.
era.
It's empty. The CT scanner's empty.
Scan. Oh my,
Think of like
oh,
how
there was
many
like,
releases I did in this room. How many releases did I do in this room with our
oh,
research, our publications, our complications? And here's my office where I used to do my podcast and all that. And that's where we were. And let me show you where we are now. Just this has been the first time we've actually debuted this for your podcast here.
there
So
is a
you get
minimum. I am having a moment. It is a bit of an end of an
it's a little
era.
nostalgic, huh? I kind
It
of wanted
is. Yeah,
to
yeah.
celebrate it with you. I kind of wanted to look back on that. And let me
Oh,
show you what we have
I
now.
appreciate that so much.
Yeah, I think it'll be fun for people, and then we'll get into the meat
Yeah,
of.
no, this is perfect.
So you can see this one now. Here's our new suite. The old
Oh
suites
my
are just our
gosh,
waiting
it's
room.
so beautiful.
It's beautiful. It's big. We
It's
have
so
space.
big and there's so
We
much
have
space.
space for all of our assistants. Okay, we still have that breed sign. Okay, we had to bring
So
that
big.
down. Here's the room I'm speaking with you right now. Okay,
Oh my
just
gosh.
conference room here, and here's our CT room, Dr. Coppelson's room, Dr. Coppelson's op room, follow-up room, sterile area,
Look
and
how
then that's
big the
in the back.
sterilization is.
Yeah, I mean it's actually, and we have like a little surgical suite in there in the back. So and there's Dr. Nora's suite, which I'm sure that you've seen as well. So now we occupy. We were out of like 1,500 square foot between all of us, like
Hmm.
babies, adults. And now we are in two suites on top of each other. And here's Dr. Nora's suite. So little cute little vibes
Oh,
here. And now we're in like
so
4,800 square
cute.
feet. But we're all really close together. And, we just needed to have a space where we could really like fulfill the mission of the Breathe Institute, to teach, to
Well,
educate, to lecture, and to see patients cohesively.
first of all, congratulations.
Thank you
Like,
so
what
much.
a stunning, I mean, not that the other one was so little
It,
but mighty.
Dude, we did so much in it, and people would come and be like, "I want to visit the Breathe Institute," right? And they would
Yeah.
come, and it's like 1,300 square feet. It's like a small
Yeah.
apartment, okay? And we would do
I,
so much, and people would be like on top of each other, like on
yes.
sitting on top of each other. We had somebody sitting in the CT scanner sometimes when it wasn't used, like checking emails, and we called it Chernobyl. Chernobyl.
Chernobyl.
Just because we were just and so now we have the space, things are more relaxed, things are more
Yes.
unfolded. And I think it's a good analogy for how the field has evolved. Because at first everything was kind of and now
Which
you can, it's just more peaceful and at ease and flows much better, I feel like.
So first of all, thank you. Thank you so much. I really feel honored and very privileged. Thank you for sharing that. And
For
I
sure.
think that absolutely brings us to, wow, how far things have come and truly the visionary of what I see. And, I do want to take this opportunity and, I'm a sentimental, emotional person. And I do want to thank you. I had Kevin on not that long ago and I was sharing something. I don't know if you remember this, but you, me, my husband, and Nora had a dinner in Vegas
I
one time,
remember.
and
I remember.
we sat down, and you had asked me, and you said, what do you want? Like, if you want to lecture, you want to speak, and I didn't know at the time. I didn't know where my space was, and I've had so much beautiful opportunity, and my time, and you being a mentor, and Laylee, and the whole team. And just being part of that really was such a massive catalyst. And I can't thank you enough for that. It really means the world.
I get
And
chills just thinking about it.
such gratitude. And, we knew that we were on a mission, and you coming into the space and bringing your credibility and your credentials and your background took something that, I had been in the airway space for, 5 or 7 years prior, but it always felt like a very Maj Podge of things we didn't know. And I remember a weekend I was in LA and I popped over to the office, and it was, I think, a Saturday. And you were sitting in that front room with your research team, and you guys were writing on a Saturday afternoon, and nobody else really saw that side of you. You know, they all saw you in the clinic or lecturing, but there you were on the weekend, right? And you're spending 5-6 hours writing research papers. And, you know, if it wasn't that time and dedication, you know, people get to see you now on stage and present all this, but I don't know how many people know all the work and the uncomfortable positions you put yourself in to get to where you're at. And that, it brings me to, I remember, I think probably in those early lectures, you shared a letter from one of your esteemed colleagues or professors that pretty much had said to you, like, you are an amazing surgeon. What are you doing? Why are you messing around with this? And I mean, that's when I just knew, I was like, your level of vulnerability and ability to be authentic was on another level. And that's what I think why it's changed and why you are, you know, who you are, because you had the ability to get comfortable being uncomfortable very early on. And so, you know, one of the things I'd love you to share a little bit is, we know about Christian Guilleminault, but like, why did you do this? What made you go, you know what, I'm going to like pioneer and like steamroll a whole movement?
It actually just kind of found me, to be honest with you. I think growing up, I got into meditation actually. Okay. And I'll never forget it. I was maybe like in high school, and it was like a Palm Springs or Riverside County Fair. And there was this entertainer there. She was a hypnotist. And I was just so persuaded by it. She brought up people onto the stage, and she hypnotized them to act like a chicken. Okay. They hypnotized them to like forget the number 7. And I just thought, like, wow, how powerful is the human mind? How powerful is it that you can program your mind to literally do anything? And so when I was there, she was selling different tapes, and I still have one. And she had one on success. It's like a 7-minute little clip. And I got it. And the clip goes like, you know, I have it like memorized by now, but it goes like, imagine yourself in a field, do a head scan, head to toe. Everything's peaceful. Everything's calm. Now imagine your deepest desire. Imagine your grandest self. Okay. And it tells you that success is achieved through hard work and dedication and by imagining what you want for the world. And so this is in like high school, early college. I would listen to this and just like meditate every day on just like what I want for the world, what I want for the universe. And it did 2 things for me. One, it empowered me to do really well in school, but it also gave me like a purpose behind what I was working so hard for. It's not just, you know, getting good grades. It was like, how do I want the world to be? And so as I was going through school, I always wanted to kind of be open, be inclusive, be peaceful, but also grow. And so I used that energy of inclusiveness, abundance mentality, growth, envisioning into my studies. And I know it's getting a little long, but I'll get to the answer.
No, it's not at all. Please keep going.
So I did neuroscience because I was so fascinated with the mind. So I did a bachelor's in neuroscience. Mind's amazing. Well, what a tool, right? What a tool. Like unlike any other. Like you can't sum it up. The heart, there's the ventricles, it pumps, it goes up, it goes down. Pretty simple, okay? Kidneys, more complex. The brain, like wow. So I mastered in neuroscience, and then I went to Harvard Medical School, where I did further research in neurology, transcranial magnetic stimulation, migraines, and I was just fascinated with what we're able to do. For a little period, I thought I was going to go into neurosurgery. And it was when I was in neurosurgery that I was absolutely devastated by that specialty. It was way, way, way too much emotionally for me. It was challenging because you would take people who were healthy and you would remove a part of their brain to prevent them from, you know, getting worse cancer. But inevitably, anyone who had brain surgery was worse off. And that was really hard for me to kind of witness. During that time, I met some ENTs and I fell in love with the specialty. And I did my first rotation at Children's Hospital of Boston. And I got to see what you're able to do. And that's where I got fascinated with airway and breathing and what we're able to do. I met some amazing mentors, who were academics who taught me the importance of continued learning and research and education, and how, the best doctors are not only those who practice, but those who research and teach, because by doing a procedure, you can help 1, 2, 3, 4, 5 patients, but by educating masses, you can really magnify the impact you're able to have. And so I was always looking for, where does the world need me, rather than what do I want to do? It's more like what's needed. And so, it's really been truly amazing. And so really one of the highlights of my career, in fact, was I just spoke at Switzerland. You were there with me in St. Gallen. Remember this event here? You were there, right?
Yeah, I was with you. Yeah, I was on the panel with you at the one event.
So, I mean, what a venue, huh?
What a venue.
Are you seeing the screen? Seeing the screen?
Yeah, I can see it perfectly. Yeah. So blown away by that attendance.
Yeah. And, I gave my seminar. This is the wrong one. So I gave my seminar, and it was my colleagues in the crowd. It was like you and people I knew who followed me, and I was able to give my story for the first time in Europe to 600 individuals, and I was able to tell the whole story of how we got to where we are. And then the standing ovation at the end after I presented my thing, it just floored me. It was probably the highest pinnacle of my career. And I would say that there are some moments in my life that shaped me, but even though this was a recognition of how I came, I'm going to meet with you in 10 years. And again, you're going to say, hey, what took you from Breathe like 2.0 to Breathe 3.0? And it was this moment to know that the work that we have done so far is implemented in every country throughout the world, that we actually have research, that we have created a paradigm. It's really fuel to keep going, to reinvest, to make space for the podcast, make space for the research, and to reinvest. So it's really this event that pushed me to pull the trigger, renew the lease, expand, grow, and double down on what we're doing towards the future.
First of all, I'm really blown away that you're bringing this up, because I have had the honor of seeing you speak a lot over this last decade. And I will be very honest with you. When I heard you speak there, I've known you. I've seen you personally in a lot of settings. And I've never seen you emotional like that. And I first was like, I was a little taken back. I was like, okay, that's a total different Soroush that I've ever seen. And then I saw some of your and I saw you skiing, and I just saw and I was like, he's having a growth. Like there's a moment something just, I don't know, there was just a moment that something clicked or where it went. And I came home and I don't know exactly what happened. I was like on the plane ride home, I felt even like you just went through something. And I think it was a really big moment of validation. And
absolutely.
It felt like when you were on those slopes, whether you knew it, because I know you did it prior to doing it, you were almost celebrating, like, enjoying life, just being free, breathing, love, like what a miraculous thing. And I think sometimes we don't spend enough time celebrating all of the wins, because there's always, there's, arguments and conversations and and differencing of opinions, but there weren't a ton of people in that first room. And now there's like thousands and thousands of people.
Huh? I mean, think of the comparison, right? Think of the comparison. And you know what's most meaningful to me, though, that really brings tears to my heart, is that the people that were in that room, that you and your colleagues, came and sat in my lecture for the 15th, 20th, 30th time, just to be part of it and just to bear witness to what we have achieved as a community. And I say as a community because it's really everyone. You were there to help start this up, but keeping up along the way. And with your advocacy with this podcast, I'm just so proud of where we are as a community.
You guys, so let's talk a little bit about the Breathe Institute. So you guys made it look a little cool, right? Between the team and, the whole crew. A lot of everybody don't know, but you made it where people wanted to pay attention, right? Like you guys brought a little style to it, slick, whether it was LA, the whole vibe, and again, the credentialing of it. And it allowed us first, let's go into talking about these doctors and dentists that you've been training over the last 8 years, right? And when you walk into a room, for some people don't know, there are some people that just want a lot of your time and a lot of your attention. And it's because of that confidence that you bring. And when you were in a room with you, I never saw anyone make, releasing a tongue look so easy and slick with the Q-tips and all those things. But there was a level of confidence and efficacy and authenticity that really elevated that experience. And then that motivated, and you paid that forward to other doctors and other providers that we now call, the Zaghi method, the TBI method, the way, and where, if somebody says you're getting tongue tie release, me personally, I'm like, if they weren't trained by Soroush, it's not my current standard. It's not the way I want it done. How have you seen your training and your development and the doctors that have taken it evolve over the time? Because your technique has changed. You've went from a little bit more to less. Can you talk a little bit about, just the technique and standard of tongue ties and where they lie currently?
Yeah, absolutely. The first thing I'll talk to you about is the confidence, right? And the confidence to do the procedure, but also to teach and also to recommend it. And I would say that one thing that really guides me is like my integrity to the truth, to the truth. And so early on when I was doing this, I was very transparent that, hey, this is the first one I'm doing. You're the first 50. The results could be there. They could not be there. We're not sure. Okay. This is a complication. This is the first complication I've had. I've had this complication many times. Just like totally transparent. I mean, think about the first time I did Kenalog on somebody. I literally told them, I have never injected this into someone's tongue before. I think it's going to work. Okay. Do you want to try? And they say yes. Okay. Think about the risk that's involved, right? But
doing that, yeah.
Of doing it, right? But once you've done it 1 time, 2 times, 5 times, 100 times, 50 times, 5,000 times for tongue tie, and we've studied it in such detail, looking at the errors, and like for Kenalog, done it like 200 times now. Now it's like, we know it's going to work. We know what the risks are.
Can I just say something about confidence? Yeah. I don't know if you remember, and I just think the people listening, I don't know if you remember that we had a mutual patient, drove back to Vegas. The patient did not tell us 100% what was going on with their blood, or they had taken some Advil or something and some sutures popped. And Nora was finishing her residency, and Nora meets me. Right, I have that case. And but something like that. But that patient wrote us a testimonial afterwards saying she couldn't believe the power of the team and then the calmness, even in those things. It just was it was just a constant validation to the ideal. But you were honest with her. You said, listen, the level of authenticity has just always been amazing. So just to kind of confirm the confidence.
Oh, no, I really appreciate that. I actually want to show you that case if you want to see it. I have it as part of my teaching files.
No way.
Absolutely. Because every time I have a complication, the most important thing from a complication is to learn from it. Okay. And to teach others from the complication. So instead of hiding away from it, I think one of the points of my success comes from, I own the complications. I say, hey, this can happen. Okay. And this is how we're going to avoid it and how we're going to prevent it. And if you don't do that, if you don't really critically look for your complications, you're really not going to grow to the extent that you could and should.
Well, you learn more from the losses than the wins.
Sometimes that's absolutely true. Absolutely.
Right, I don't know. Right now, JJ, my little guy, is hardcore in sports, and he always wants the W. But we're always coaching him and telling him, like, you learn so much more about yourself.
Yeah.
When it doesn't go perfect.
Here's the case. So this is the case. Okay. So this is your patient. Okay. This is like 8 years ago.
Yeah.
And so the patient had bleeding under there. We were using a scissors technique, and we would tie them too many sutures here. And, scissors technique. So they would bleed. And so the wound kind of opened up. You got a hematoma. You got some infection. And I had you clean it out for me. I don't know if you remember this or not. Do you remember this?
Yeah.
This is the case.
Yeah. No, I know. Exactly. Yes.
We're on the phone and we're kind of guiding you.
Yeah. We had that on FaceTime. Like we were doing the whole thing together. Yes.
Yeah. So, and I use them, to teach
but
other
I've learned,
people.
Because of those things, there was a level of confidence, you always gave us confidence to learn from that, how to watch the tissue better, and honestly, the number one thing I think we do well now is we coach myofunctional therapists so much to be better advocates and support for their patients so that we can really set doctors and providers up for wins. So, it just was another level of evolution for the collaboration.
I want to make one more comment though.
Yeah.
And that's the power of overtraining. Okay. So over-educating yourself can be very helpful. Because the reason I'm so confident with tongue tie surgery is because I trained in head and neck cancer surgery. So I dealt with big wounds and complications in a much bigger context. And I've
Yeah.
kind of like overtrained and dumbed it down to tongue tie, where other people say, oh, tongue tie is like beneath me. Like it's too easy, it's too simple. And so as a similar analogy, I would propose that the best therapist, even if it's not applicable to what you're doing immediately, you're a speech therapist, if you're able to take that extra training to learn about primitive reflexes, to learn about hypermobility, to learn about tongue space, and to overtrain, then when it comes down to the simple case, you can execute it with immense mastery and confidence because you understand the whole thing and you're operating in the, the bottom of your skill set rather than the top of your skill set.
Which I would say is what brought me a lot of confidence. I've sat in lectures.
Absolutely.
I don't know if you remember the one after that. I took Bill Hang's year residency. I couldn't use any of that. I flew every weekend, flew out there, would bring doctors. I went through that residency. All of those aspects.
You've seen it all. You've seen everything.
Yeah. So
every
even though I wasn't going to be able to do any expansion, I understood it so much better. And therefore I could communicate on it and I could really help, tee up the patient and set them up and then streamline things, which is really important to set expectations up for patients and understanding, because going into the next area is, listen, there's still some resistance in the movement that we're doing a little bit, right? I mean, we still you and I sat on a panel in Switzerland and people were coming out with some questions.
I'll tell you, some of the resistance doesn't bother me anymore at all.
Yeah.
And some really bothers me a lot. And
if
you had a question.
Do
you mind if I
please, let's go.
All right. So when there's a doctor and they don't know, okay, patient comes in, I saw my pediatrician, they didn't know if there's a tongue tie, okay? They don't know what I should do. Totally doesn't bother me. That's okay. That's okay. All right. It's all good. It's all good. They don't know, hey, we're here. It's just one more reason for me to make an Instagram video to like clarify that point. So when someone says, my pediatrician didn't know, I make a video. Hey, pediatricians, this is how you assess for tongue tie. Or hey, this is how you check for tonsils. Like, hey, people don't know. They want to know. It's all good. Doesn't bother me. What bothers me so much is when people present something at a conference and then they say, but we need more research. We need randomized controlled trials, okay? Or when someone asks me after listening for an hour and a half to my seminar, okay, but where are the high-level randomized controlled trials? There was this one thing on Instagram recently. It was an orthodontist. I don't know if you saw it or not. Did you see that little post? It was this amazing doctor who was doing expansion on a 3-year-old, and some orthodontist comes. I don't know if you saw this or not.
Oh, yes, okay.
Don't judge, okay? And then she goes, the first thing I want to know is where is the high-level evidence for this? And I wanted to jump out of the screen, okay, and like pull my hair out, okay, because this is someone who thinks that they know and they don't know. And that bothers me more. It's the people who should know, who don't know, and who portray that they're the authorities and you need to have high-level randomized control trials. Because the truth is that there are no high-level randomized control trials for anything that you do in dentistry or pediatrics or orthodontics, because you can't. You can't randomize control trial a 3-year-old to orthodontic treatment, to tonsillectomy, to myofunctional therapy, to physical therapy. And so if you're saying that we need randomized controlled trials on babies, okay, from a point of authority as a PhD, as a researcher, it's really a disservice. It's really a disservice. It's
because you're really claiming something, like calling somebody out, but you can't even do it. So it's not even a realistic call out.
It's just so backwards. It's just so backwards, and it's so limited, and it's so defensive.
I love that you use the word defensive, because as and don't mean to go off too many around, but like, I've done a lot of work on my own brain and I've done a lot of work and it's all because of this airway movement. But one of the things I've learned about defensivism because I was defensive and insecure in a lot of ways. And it was because I was scared and fearful and, I didn't know who I was or I thought I was going to lose something. And I have found as I have gotten stronger and more confident in my own space and in my own place, I can hold such better conversations. And now when I see an orthodontist, I just had someone called me the other day because I'm living down here in the crazy South, and an orthodontist who's a very nice guy says he's getting all these patients and he pretty much calls me and says, listen, he starts off really defensive. I'm about to put together a little presentation to really talk about how there's no evidence to talk about any of these things. And I said to him, I go, when you get that presentation put together, I'd love to come stand up next to you and I can do a side by side of what we have done. Finally calms down and then he finally says, you know what, Melissa, listen. Here's the truth. I don't have the ability or the patience to deal with these little kids, my staff. And then he says, listen, I gotta go. I got a kid at home. I want to golf on Fridays. Okay. I finally said to him, thank you. He calls me the next day, sends me a text, and he apologizes for what he says. And I actually wrote back to him. I said, no, thank you for being authentic and honest. It's not that it's just not the right thing for you. You don't have a purpose for it. No big deal. Like, totally respect you. But most people want to get defensive and say no, instead of just saying like, listen, this is a lot of work. It changes a lot of things. Do you agree with that? Because that's what I'm really coming to. Notice that it's more of a fear.
100%. 100%. It's their fear, their ego. They don't want to deal with it. So then they pull out research, right? Oh, there's no research. So just so everyone's well aware, the only thing you can randomize control trial are medications. That's it. You cannot randomize control trial functional therapies. You cannot do it because they are
so physical therapy, PT, no randomized, right? No therapy.
You cannot randomize double-blinded placebo-controlled.
Is there randomized studies for speech therapy?
I don't think so.
Okay.
And if they are, they're all negative. They're all negative because you could do the study. You could randomize people, but you're not going to get any results because this is not a standardized treatment. These are individualized treatment. It's not one pill that you take. It's individualized. And so
everybody brings a different variable.
Trial, they're putting you through a standard thing. And as soon as you standardize something, it's no longer individualized or functional.
Because every human brings their own variables.
And they're multifactorial.
Multifactorial, yes.
It's multifactorial with many steps, okay? It's not just a set of exercises. If you just give a random set of exercises on pre-enforcement, the results are going to be so-so because it's individualized. Looking at compensations. What is this individual? What does that individual need?
So it's interesting you talk about this. I was just looking. I didn't realize. So like most ENTs, when they, Flonase or all those things.
Sure.
Most of the things that they're asking patients, they don't have they'll ask patients, do you feel better? Did it feel better? Like they go off of what the patient says. It's not like
yeah, right? It's called patient-reported outcome measure, PROM, patient-reported outcome measure. And that's what they're reporting on. But when it comes to us, it's too subjective. You need more evidence, right? So I just want to call out the BS for what it is. I just want to call it out. That when people say you need more research, like what are you really saying? Like what's all that about?
What's that about? What are you trying
What's that about? Just a word you heard, or do you really mean it? Because research means researching for the truth. It means learning, and you're supposed to learn from whatever is available for you to learn from. Okay? And if it's
let's be honest,
that's research. If it's a case report, if it's a case study, if there is no textbook set, that's not an excuse for you not to go and learn about the topic.
All of the patients we have seen over 10 years, 8 years, I mean, reported outcomes, and you've done a great job.
We published on those, yeah.
They're published, so there's not there's not.
Yeah. We've even done randomized control trials, myofunctional therapy and tongue tie versus myofunctional therapy alone. We even have that. So it was a crossover trial. So we have the studies, okay?
To show where it comes to
100%, and we have it standardized. We have it organized in our recent 2026 paper.
Yeah, the 2026 one. Which brings me to the conversation of tongue space and expansion. It's a hot.
Let's talk about that.
Everyone loves to bring that up. Okay, so I remember the first time. Because in the beginning, those first couple of years, I remember coming to you, everyone I worked with
Yeah.
had expansion because I always worked with orthodontists. So I remember presenting the case to you and you would, I would put it up
Yeah,
on the
you had the Myo
PowerPoint.
braces. You were expanding with that, I
Yeah,
remember.
myobrace, or we would do, the three-way sagittal expansions or
Love it.
whatever they
Yeah.
had. MARPE and TAD expansion and the mind. I mean, it's changing the game. I actually
Amazing.
said to somebody, I go, if there was a stock, ability to invest, I would be investing in 3D printing imaging and where we're seeing technology take orthodontic and expansion. And so I'm just curious. I mean, I saw the new research. I've seen there's conversations, research going on that. The tongue space topic, can you just talk a little bit about it?
Oh, 100%.
Yeah.
So just want to reiterate how enthused I am by how many high-level providers are doing this kind of work, how they're advancing the research, how there's a MARPE symposium, with Audrey Yoon and Mariana Evans and Ilya Lipkin and Richard Ting and Juan Moon and everyone and even Jeremy Manueli, just everyone all in on that topic. They're doing such a great job of advancing what's possible from MARPE to mandibular expansion to SFOT to, wow.
Yeah.
I think your question's coming from like, how do we diagnose the tongue space? Is that what we're talking about?
So a lot of myofunctional therapists or even dentists, let's be honest, they're still questioning it or saying it. So, to me, I feel like it's becoming quite the standard of care these days. But yeah, how are we diagnosing it? How are we determining?
Absolutely, like if you really want to look at it, you need a CBCT exam. And it needs to be done according to our breathe protocol, where it's, horizontal visual access, mouth closed, swallow once, not with the chin rest like this,
chin up. Mm-hmm.
not pushing your tongue up, okay, not cut off, not with your chin tucked down. If it's done to the right protocol, we've shown that it's very reproducible to accurately assess for the tongue space, understanding that when the head goes forward, the airway opens up, when the head goes back. And there's basically three things we look for. We look for the maxillary width, okay? How the teeth are tipped out. So sometimes you see a very large mandible, but it's very high arched and the tooth roots are angled outwards on the top and angled inwards on the bottom. Okay. That's like a good clue that, hey, something's up, something's being camouflaged. Anterior, posterior, we measure based on the shape of the posterior airway space. Okay. Not just the dimensions, but if there's like a constriction point, that's more significant than the actual size or volume. And then the new one that we're looking at is the position of the hyoid bone and the cervical mental angle. And so the hyoid is another element that when you have like a descended hyoid, when it's very like low and you have like an obtuse cervical mental angle, we also find that is a relevant prognostic indicator. So those are the three dimensions that we're looking at.
So is it fair to say if there's a dentist or somebody out there who's claiming to be an airway doctor or, screening for sleep or prescribing these things and is not taking a CBCT? Yes.
No. Yeah. That's like, yeah. That like you have no idea. You have no idea.
You're shooting blind. You don't know what you're really, and that's
absolutely.
There's a lot of them out there, Dr. Zaghi.
I don't understand how ENT doctors, okay, prescribe adenoid surgery, tonsil adenoid surgery,
and do not without take one.
Vision. That blows my mind. Okay, if your kid has sleep apnea, they don't even examine you. First step, tonsils adenoids. That is unbelievable. Do you understand?
Let me tell you there's an ENT down here, whatever. JJ has had lots of things, really struggling with his sinus situation, and I just needed to get a CBCT. So I call his office. I said, can you take a CBCT? And he goes, he literally had to dust the machine off. like I'm not joking. He was like, you really want this? He's like, it's a little aggressive. I said, I'm okay. I'll sign off. I'll sign away. No big. I just need the imaging. And then he goes, what are you going to do with it? I said, I'm going to send it to Cone Beam. I'm going to send it to Beam Readers with one of my colleagues. And he just looked at me like I had, they want to stick their head in the sand. They don't want to look at, a lot of people still really, really. And I'm in it, I guess I made a joke. My life's mission is to move to places in the country that are very far back in time and fight the fight.
I think it's got to be forefront. I think it's got to be forefront for your assessment, and it's got to be done well, and it's got to be done right. There are people out there who say that for the pediatric population, I'll take like a little offense to. They say that, you have to be careful with pediatrics. You want to go by the ALERA principle, as low as reasonably possible, and consider the risks and benefits of imaging in kids. But the truth is, if you're really talking about the truth, is that you can actually measure how much radiation is coming from your scanner. You can get a radiation dosimeter. And I think that every dental office and anywhere that they have x-rays should purchase one of these. You can get on Amazon, radiation dosimeter, and you should measure how much radiation is coming from the scanner. You should measure it before you open up your mouth and talk about how much radiation it has. It turns out that when the ENTs send a kid for an adenoid x-ray, that is 1,000 times more radiation. 1,000 times more radiation than what I do in the office here. What I do in the office here is equal to 1 hour by a window. That means that if you're out by a window, it's 0.08 microsieverts per hour. And the scanner, if you're in there, you get 0.08 microsieverts per hour in one shot. That's it. That's it. On an airplane, you get on the order of not 0.08, you get 1 to 6 microsieverts per hour on an airplane. So people really have to understand that the dosage is very, very, very low, and the risks of not identifying a problem are much greater than the minor radiation that you get from a CBCT exam.
Well, I appreciate you just clearing that up, because that is a big conversation. And I really have told many therapists and doctors that there's really not much of a conversation to be had if they're not willing to invest in the proper CBCT. I say to all of them, I go, you guys can become the best airway screeners. We need more people to screen all day and every day, and go screen your patients and then send them to other, people that are more prepared. And I think you guys showing what the future really looks like in this combined practice concept is where we are going. I would get my arm chewed off. I did poll some people of questions they wanted me to ask you. I did get a couple ones, and I weeded out the ones that were too crazy. But the one we did get the most was, within your opinion, with understanding that you have there's a lot of different factorials to it, but the conversation of myofunctional therapy, where does it go? Where does it belong? There's a lot of movement, a lot of moving pieces within it. And, I understand there's fear and there's different places where it goes. And I saw you made a really great quote on some of the different platforms. I know they had you on at the IJOM and things, but I was just curious if you'd be open to just chat about it a little bit, where you see it going and all
100%.
That stuff.
We actually have an article coming out in the IJOM. It's called the History of Myofunctional Therapy, where it is and where it's going, in which we outline some of these ideas. And so if you consider the myofunctional concepts, they're over thousands of years old. The concept of keeping your mouth closed, breathing through the nose, chewing and swallowing. These are things that are taught in Native American tribes, in indigenous cultures, as a basic foundation of life, okay? Just like you wash your hands, just like you brush your teeth, learning to breathe through your nose, chew and swallow with your mouth closed, I think is integral. And I think that lesson should be taught in preschool, kindergarten, first grade by school grade teachers. So when should this be implemented? School teachers in kindergarten and preschool. Just like you learn to go to the potty. You don't need to be a urologist to teach your kid to potty, okay? That's not how that works. But if there are red flags, you're trying to teach a kid to potty, but something's wrong. Color's not right, okay? The stool's not right. The kid looks weird. The red flags that you elevate to the next echelon of specialty. And that echelon takes a look, might be a nurse practitioner, a primary care doctor, try to sort it out. And if not, to the next, till you get to the subspecialist. And I think myofunctional therapy should be the same. I think that there should be a baseline where everyone, no college degree, just this is how you wash your teeth. All the parents, how you wash your
myofunctional educators, airway educators, whatever you want to call them.
No education, no experience, preschool teachers, basic, okay?
You learn CPR, you learn basic. Yeah.
CPR is even higher than that. CPR is one notch higher than that. Okay. This is washing your hands. Okay? Like, who is qualified to teach someone how to wash their hands? Okay? That level of knowledge basis.
Simplicity.
Okay? Yeah. I mean, my 6-year-old can teach my 3-year-old. This is how you wash your hands. This is how you use the potty. All right? And then you have higher and higher when there's a problem or when you're trying to treat a disease or disorder. Okay? So the basic level, this basic level needs to be flagged for, this is a disorder. Once you have a disorder, Once you have a problem, once you have a diagnosis, now you need a licensed healthcare provider to execute that treatment. So that's where we have to make the distinction kind of grossly, that there's basic education and then there is medical treatment. And when you're in medical or dental treatment, you do have to be a licensed healthcare provider to execute that treatment. And there are regulations across that.
So with that, I know you guys are always in the forefront of, being a part of these conversations. And like anything, one of the things I love that you're going back to the history of Myo. One of my favorite places is to go back to the history of hygiene, because for 50 years, if not even more, hygiene was just a dentist took his sister and, and they started to make state regulations. And then hygienists eventually, hygienists didn't become a licensed profession till 1960. Okay. And then it started off in pockets before the complete ADA picked it up. So this isn't like brand new. This has happened in multiple massage therapists. Like they all had an evolution. And so I just always assumed that once it became important efficacy, we showed the importance to validate that then naturally there would become a governing body down the road. One question that a lot of people ask is, do you think that if that was to ever happen, there would be a grandfathering, like a rule for certain people? What I have seen in history is that, usually if somebody's been doing it when a law changes, I go back to like when they made the alcohol law, they took it from 21 to 18. They let the 18-year-olds go along to the 21 and they made a cutoff date. And then anybody something along those lines, because there's questions of in the next 5 to 10 years, there probably will be more regulations and regulatories of it, where there should be if we keep growing as an industry.
A terrific question. So the question you're asking is about guidelines and how state regulations come to be, and how, the ability to practice like allopathic medicine from osteopathic to naturopathic medicine, how these things are developed. And I'll be honest with you and say that these are entirely political, and non-scientific. So there's no scientific basis for any of this. And anyone who says, well, I am more educated and I am, did this much training is really BS. Is really BS. Okay. It's that there's no scientific basis to that. All right. It's a political issue. And so it should be treated like a political issue. And if you can be transparent, if people can be more transparent about it, that, hey, I'm threatened. I invested so much in my education and I don't want you coming in. That's more honest.
Yes.
And now we can make political agreements that, hey, we have to respect your territory. We have to respect that person's territory in order to encourage further education. For example, you look at hair barbers and dressers and cosmetic. They need to be licensed. Why? So that they're being rewarded for the effort of going to a year of school and training and to make sure and to promote that process. Because you don't want someone off the street, right? Because then they haven't learned like how to clean the razor. You get hepatitis.
Yes, of course.
It could be dangerous.
Right? Well, you got to protect the public. You got to protect the public.
So people have to be educated to a certain extent, and you have to reward the people who seek that education. Okay.
Agreed.
But that's really where it is. It's not that, I'm smarter than you. I did more training than you. There's no way that you can understand this. I don't really buy into that kind of thinking.
Well, I appreciate that. And thank you so much. And I want to be very aware of your time. And I thank you so much. But there was one other area people wanted to talk about before we wrap up is social media and content in social media. And I got to give your wife a lot of credit because, I love Nora. I've loved her forever. She'll always be near and dear. I think you made a good choice there. She was, one of the first pediatric dentists, and her and I would chat for so long. I remember when she really came up with the idea for Breathe Kids and stuff. But she really made a forefront of saying, listen, social media is where it's at. And if we do not get in front of it, and I remember a little bit, she's like, and I remember the first time you two kind of did a social media, I went, oh my God, Zaghi's making content. But it's been really powerful. And where questions came backwards, how much time a day or like a month are you adding to your social media? How much a part of your marketing and education plan is this for you guys? And, what made you guys make that pivot? And how would you think about it from an industry?
I love that. So well, Melissa, that as soon as I started lecturing, I put my stuff on YouTube. I put patient testimonials 5 minutes at a time on YouTube, and I put my lectures full on YouTube. And I would say that the best video I have on YouTube maybe has like several 100,000 views. Okay. And that's like my best tongue tie video. All right. I just posted my entire Switzerland lecture on YouTube. So if someone goes in and types in Zaghi tongue tie, they can listen to the whole hour and 40 minutes. I'll be honest with you.
We'll put a link of that.
Yeah. It's got 400 views. Okay. And if I pushed you and promoted it, it would maybe get to 2,000 views. Just because
of the long form. Because of the long form.
Yeah. But if I do like a 90-second or like a 90-second, some of my things, they get like 50,000 views, like boom, within 2 days. And some of them get like 500,000 or even 1 million. So Nora and a lot of hers, she reaches 1 million eyes.
It's crazy.
It's just so, I mean, what we want to do is we want to spread the knowledge and the awareness. And if you want to make that impact, yes, I continue with my YouTube and, I still have that. And we still, do the long format, which I'm much more comfortable in a long format. The short format is very challenging. Nora has mastered it. She is so good at it. I'm on vacation with her and she's like, babe, just record me. And I get up my camera and it's like a different person appears. And she's just talking and she's articulate and she's like beautiful and she's engaging. And so it took a lot for her to get there from trial and error. But her content's good. Sometimes I'm looking at it, I'm like, damn.
Oh, her content.
That is fire. That is good.
Fire. And she's really made it and done it in such... I want it, and I'm going to invite. I would love to invite her on.
Nora Zaghi, if you guys want to follow her.
Yeah, we'll put all her stuff in there. But because the best part about what I think Nora has done, it's tasteful, it's funny, it's engaging. Even when the boys come on, it's like you don't really see them. Like you know what I mean? You see them,
she doesn't show the kids. Yeah, because
she doesn't show the face. But yet you feel that like this is your guy's life. Like it's so authentic.
Absolutely.
And I think that has been so moving. And one of the things that we have seen a lot with the consulting stuff is that doctors that aren't creating a niche or marketing in this form, they're kind of missing the boat a little bit.
Yeah. It's challenging. Like, for example, when I make a video, each video that I make takes me about 2 or 3 hours for that 90 seconds. So it's very hard for me. Nora's got it like trimmed down. She has like a day where she'll record like for 4 hours. And then she has a day where she'll review. She's much more streamlined about it and really good about it. But I know with this new space that I have, hopefully I can get like faster and better at it. I don't know. But it's hard. It's hard. Even these podcasts are hard. It takes a lot of time, right?
It's a lot of time.
It's a lot of time. It's like 45 minutes here, but you got to spend at least 10 hours getting the person, organizing it. It's a lot of work. People don't understand.
A lot of work. Do you see yourself possibly, you guys see your first, like eventually there being a true role? I mean, I know you guys have had people on the back end that do a lot of, graphic, but eventually having social media content, like having editors and stuff like that to help move it.
We both have editors. So we both outsource it to different people. So we don't edit it ourselves.
Oh, okay. So you're already investing in that.
I'm not sitting and video editing it, but you still have to tell them how you want it edited. And if I do a rushed job of it, it doesn't come out good. Okay. So these are people who, you have to like literally walk them through how you want it edited. You can't just edit this and then like the AI. It just sounds stupid. So you have to really.
No, it does.
So when I do it, what I do is I film myself saying, here are the clips that I want. First put this picture, then put this picture, use this part, use that part, use that part. And then I give it to some company and then they give me the video and we go back and forth.
Okay. So that you're working with it. Well, I really appreciate you even just diving into that because that was definitely a conversation people really had was, is that neat? I think that is the future. Kim Kardashian just made a comment saying, if you're running a business in 2026 and you don't have a social media presence and you're not doing it, she goes, I just don't know how you're going to last long term when we're trying to hit people on a massive level.
Absolutely.
Well, Dr. Zaghi, of course,
I could fun. I always love chatting with you. I've missed it. This is so fun, Melissa. Thanks so much for inviting me.
I really appreciate it.
Yeah, this is a good one. This is a good one.
I think. Thank you. I hope it's at least fun. I just always want people to have a good conversation. And we just ask each guest, we ask them at the end, when they think of the word, or the podcast name, Mind Your Mouth, what's the first thing that you think of and what comes to mind?
I love it. I love it. So, Melissa, you're someone who's so funny, so genuine. All right. And I think it's so appropriate to you because in a way, like you're like minding what you say. You're very careful of what you say, but it's also about the mouth. So I like that. but I have to say you were lecturing one time for the brief course, and we had this like reusable TRMR meter. Do you remember this? It was like a reusable meter, okay? And you were like demonstrating, here's how you use it. And then somebody asked like, do you wash it in between or do you sterilize it? And you said, I'm not the OSHA police. Remember this comment?
Yes.
But I would probably clean it, something to that extent. And just
Yes.
your humor,
I said, I'm not
driving
the
the point
ocean
home the way that you're driving the
Well,
message home. So, the way that you use the humor to get your point across, I think is very artful. And so I think that you're really minding the way that you're using your mouth and really kind of pushing things with humor and love and openness and just charisma. So it's a great podcast, and I'm sure your viewers will really enjoy getting to know you and your further growth.
Thank you so much. Until next time, guys, enjoy your day, mind your mouth, and we'll see you on the next episode.